Here today with Dr. David Langer, the founder and chief medical officer for Playback Health, and you are here at the Innovator Summit, and you were talking today about, well, the topic of discussion was clinical solutions to solve healthcare's most pressing issues. That seems to be like that could be a pretty broad canvas right there.
Yeah, it can be.
So what was the message that you wanted to get to the people attending?
I'm not sure I really had a message other than more or less describing from my post and my perspective what I'm experiencing. And both as a founder of a tech company that's been at this for quite some time, as well as a physician that's trying to do creative things and be better doctor and be better for my patients. And those two opposing forces have filtered through me and have resulted in an experience that I enjoy talking about because it gets me thinking. And when I'm asked questions, I'd rather not know the questions ahead of time because it allows me to really think more critically and not whatever comes out comes out. So I didn't know I wasn't necessarily here for a direct message.
Well, I'm intrigued because a lot of the people that I talk to that come to this conference that have innovations are people who examine a system and look for weaknesses. You're in the system and you're operating it, and you see what functions well and what doesn't, and so some of your inside innovations are born of genuine frustration with the procedures that you have to go through. It's a bigger investment to me, it would seem.
It's incredibly frustrating, but there's no innovation ever happen without frustration. If everybody's innovating, it'll work. The world would completely come apart, you know. And so you have to get sort of used to the frustration and accept it as part of that. Comes with a lot of frustration. I mean, Greg and I talk all the time about this. I get not depressed, but melancholic or euthymic about this stuff because there's certain obviousness to it. And obviously I want to be successful and I'm ambitious, and when you run into some headwind and from wherever it's coming from, and you just have to shake your head and keep going, and without really knowing whether you'll be as successful as you could be, and that's part of being an innovator. But I'm also a doctor, and so I get to operate and I get to take care of patients, and so I have another source of gratification that they can never take away from me. And so I'm very grateful for that, and I've worked long and hard to be able to do those things. And this tech piece is another challenge that I'm not sure how it's going to end up. But it's already been a remarkable part of my professional life that I have less to show for it, but certainly more built in, and I can certainly give good advice, for better or worse.
Well, let's talk about technology. What parts of it do you see that you're using and that you anticipate using that you really like?
I like what I helped to develop. It's my selfish bias, but I don't think that's probably why the most likely benefit is in AI. Since we're talking about AI, to me is the notes and ambient notes. I met with Nuance a number of years ago when they were the only show in town, even before they were part of Microsoft, and then subsequent to the Microsoft acquisition, and I was just blown away by the possibility of this, because ultimately we were designing a tech that was very cool, mobile, web, making audios and videos for your patients for one another, memorializing moments, audio discharge instructions, videos of your MRI, and very bleeding edge and very valuable for the patient, but it wasn't really as valuable for the doctor. It's valuable to me. I've found when I store these videos, if a patient comes back to me, I go and look at the video, what I said to the patient, so it's a much better form of electronic medical record. But
right.
That's like third generation. If you're introducing to somebody to it, they're like, oh, this will be great. For me, they don't see it that way because they haven't used it yet. So you can't really show it to doctors and have them understand that so much. But any technology adoption, people have to understand it right away for it to make that. And ambient, people get it. And from the time I was a medical student, writing notes has been a chore. Whether it was writing with your hand, I'm not a really good typer, so it's even worse. And the truth is, it is a chore, and it's being done for basically three reasons. One, for billing, two, for medical legal reasons, and three, for documentation. So the first two are even more important, frankly, and they're not about us at all.
Right.
And so we're held back. And when the minute I saw ambient, and when Playback, moved this kind of whole LLM, generational AI note making into our platform, which was making audios and videos to begin with. And now I can make an audio or a video for a patient and create a note. I was like, it was an oh my God moment.
Yeah.
And I think that using ambient at the point of care now for a year and a half, I've been written a note or typed a note in a year and a half. And I've used the bedside preoperatively for my consents. I've done end of life discussions where it creates which I never would have made before. If I'm going to have an end of life discussion with a family or withdrawal of care for 45 minutes, the last thing I'm going to do is go back to my office and start typing on it. This is what I talked to. I'm not doing it.
Right.
I'm just physically not doing it.
Right.
And so it's so much better because anything I do can be memorialized, it can be billed if necessary, it can be put in the chart for medical legal reasons, and I do nothing. And so I accomplish all three goals by just talking.
Right.
That's extraordinary.
Yeah, you're
and
pretty.
That's breathtakingly cool.
How much time has it saved you?
I don't. It's not only time. It definitely. I mean, it probably saves me 3 to 4 minutes per patient, minimum. But what it does do is, like, if I see 21 patients in my office, I relax. Like, I just don't have to sit there and talk to you like I'm taking notes in my head. And I learned to use, knowing I'm using AI, I change the way I ask questions because I know it's listening.
Right.
I also, so it's taught me, read all these things, is AI going to take over? Doctors who use AI are going to be better doctors who know how to use it. And so you immediately start to understand sort of how to function with it. And you remind it, hey, well, the plan is number one, and you sort of goose the thing. You say, my plan is this, and it just pumps it out. It's like, no problem. And knowing that makes me a better doctor because I'm more relaxed, I'm more myself. I even tested it, patients like, I'm a Mets fan. Oh, you went to the Mets game? Yeah, and I'm a Yankee fan. And it's not in the note. So I don't worry about that. So I can be a human, and I'm not, looking at my computer or writing things down or in a hurry. A lot of times you have your note to write, or you got to memorialize something afterwards. We're constantly know when I got another patient in the waiting room and there's somebody in the other exam room and I'm behind. You're constantly behind. And then, let me pump 3, I'm late, so I got to go through these 3 patients, and I didn't write any of those notes. Now I got to go back to my office when I do get a break, and there are 3 or 4 patients that I just saw, and I got to remember, like, what each one of them said and their meds, and then you end up going to EMR to look up, and it's horrible. So what's more important than time saving is just the environment. I love my office again. Like, I enjoy I can be a doctor, and I even, as a surgeon, we love doing procedures, and if I don't get a surgery out of it, I would get upset. Like, today I didn't get any surgeries. You know what? I kind of enjoy being a doctor again. Like, I can help people just by talking to them and by listening and being a human. And that's what's so interesting is here you have artificial intelligence making me more human. That's really cool.
It actually becomes a teammate, part of the team.
Absolutely. And I think that envisioning where this is going to go it's extraordinary. I mean, I think of all the hassle of doing this stuff over the years, from very early on, like I'm talking about medical school, and what you had to do and the stress that caused you. And I just think it's solving a critical need problem that will revolutionize how doctors care for them. I think people will be more likely to become doctors. I think it's going to be easier to do your job. You're not going to have some of the stresses and this kind of pajama time that people talk about and lugging charts home. And it's just the beginning. And it's just extraordinary. I mean, I said earlier, I wish I was 20 or 30 years younger. To be part of this now is kind of like, it's a little bit nostalgic. I have no nostalgia to writing my notes, and to think what your life would be, if you didn't have to do that, like, it's really, really, it makes you happy thinking about it. Like, yeah. I'm really, really happy.
But look at it this way. I mean, so you have all this experience, and now you've entered a new phase of your career,
yeah.
which will, if you want to, be probably extended longer than you dreamed.
Yeah, there's a great book called From Strength to Strength by Arthur Brooks about that. And I read it, and it had some relevance to me because I didn't look to this as a second career necessarily. It really was the same career, just want to make it better. But I'm a surgeon, and I'm 61. And so you got to ask yourself, we all know it's going to end. And surgeons are notorious for dragging this out because we love to operate. But as you get older, you can't be as good. I feel like I'm as good as I've been, but who knows? No one's measuring that. But I agree with you. I think that this has given me another area of interest, of kind of excitement. It's totally different than surgery, and it serves my brain very differently. But I think that the opportunity to contribute in a big way is much greater in this space than it really was in my surgical space. Mm-hmm. And I think that being an early adopter or a bleeding edge innovator and being part of our great team at Playback with my best friend Greg Odland, who mm-hmm. helped start this company, to have the team and the group and to have the culture we have and to be able to experience Playback success as well as bringing it to the point of care. Yeah, it is definitely something I'm excited about, of having this other piece of me and then seeing where it goes. So it's great.
And you have this platform at the HITLAB Innovator Summit to kind of toot your horn and let people know, yes, this is new and this is happening and this is how it's changed my life.
Yeah, I mean, it continues to change my life and the lives of my patients. And I think that it's been really a project of a lifetime in a lot of ways, frankly. So.
Well, congratulations.
Thanks.
I'm feeling better just sitting here talking with you. So I don't know if I get charged for a visit or not, but
I won't charge you. I didn't record it, so I won't charge you.
There you go. Well, David, thanks so much. Thanks for coming by today.
My pleasure. Nice to meet you. Take care.